In this section of clinical practice adaptations, we're going to focus on infectious disease and prevention tips. So our learning objectives here are really to look at the climate-sensitive risks of infectious disease, particularly the ones that are important in Montana, and talk about some steps that health professionals can take to help reduce patient risks. Changes to infectious disease patterns as a result of climate change and environmental degradation will impact our clinical practice in a number of different ways. We'll see changing patterns of infectious disease in the United States. We'll also see changing patterns of infectious disease around the world. So even if you're not practicing, you're not participating in some sort of global health, you will potentially be dealing with this if you have patients who are traveling and potentially exposing themselves to various risks of infectious disease around the world. There's also going to be an increasing number of climate refugees from around the world with different patterns of endemic disease, and we always need to remember the environmental drivers behind some of our antimicrobial resistance, as we have low levels of antimicrobials in our environment, in our water supply, and everything that are contributing to the overall impact of antimicrobial resistance in the world. This section really here is going to focus mostly on changing infectious disease patterns in the United States and steps that health professionals can do to educate patients to avoid those effects. But I did want to just highlight why infectious disease, even if you aren't in this specialty or you're not necessarily concerned about dengue or malaria or something in a day-to-day practice, it's still important to have some awareness. Climate-sensitive changes to infectious disease risk will occur in different categories of disease. So, for instance, in the case of zoonotic and vector-borne illnesses, we may see that warmer temperatures are affecting the life cycles of pathogens and or the vectors that may prolong transmission cycles, increase the risk of transmission to humans. We might also see things like flooding and standing water increasing mosquito habitat, encroachment on animal habitat that's going to increase our risk of human-animal contact that may result in transmission of disease, maybe changing abundance or geographic range of vectors and hosts that can change risks due to these complex ecological interactions. So thinking about, rabbits, foxes, predatory birds, how does that all play? These are complex systems. So we're not just talking specifically about mosquito distribution. Water and foodborne illness will also be important. There are 8 climate-sensitive pathogens that are responsible for about 97% of all waterborne illness, and that includes norovirus, rotavirus, adenovirus, campylobacter, E. coli, salmonella, cryptosporidium, and giardia. So the survival and persistence of these organisms is influenced by temperature, and extreme weather might also affect water availability and water quality, as sewage treatment plants are potentially overwhelmed by floodwaters or excess rain, potentially also just disruption of clean water supplies. There may be increased risks of transmission and new disease patterns as people are displaced due to climate change. So thinking about somebody maybe moving into an emergency shelter, higher population density, increased risk of transmission of these types of illnesses. Likewise, this is true with communicable respiratory disease. Changing temperatures and poor air quality might increase the risk of transmission. We also know that the population density that might result in might be a result of displacement can change our risk of transmission. And finally, invasive fungal disease. Alterations in soil ecology, hydrology, temperatures, etc. might change both the persistence of the invasive fungal pathogens out there and may release infectious spores. So not all of the diseases mentioned in the previous slide are going to be relevant in day-to-day practice in Montana, although I do think that it is important to think about these changing patterns. This table here on this slide shows the vector-borne illnesses that have been reported in Montana in recent years. And you can see on the left-hand side, diseases that have been acquired in Montana and reported with the average number of reported cases per year. And on the right-hand side, looking at diseases that have been reported in Montana but are believed to be acquired outside of Montana. Within Montana, we have Rocky Mountain spotted fever, tularemia, Q fever, Colorado tick fever, and tick-borne relapsing fever. Rocky Mountain spotted fever and tularemia being the more common, less so with some of the others. Mosquito-borne illness in Montana right now is limited to West Nile virus, approximately 22 cases per year being reported. But we also do see cases of malaria, Zika, dengue, chikungunya, and yellow fever being reported on occasion, and those are acquired outside of Montana. Tick-borne illness, right now we don't have any known cases of Lyme disease acquired in Montana, but that is a significant concern in the northeast United States. African tick bite fever, anaplasmosis, babesiosis, ehrlichiosis, all of those have also been found in Montana and have been reported but are not acquired in Montana. All of this information can be found through the Department of Health and Human Services and their Communicable Disease Unit. These reporting and surveillance data are updated on a regular basis. Vector-borne disease in Montana, if we look specifically from 2003 to 2018, we can see that there is kind of a trend in tick-borne diseases reported in Montana residents, and this breaks it down between tick-borne disease acquired in Montana in the yellow and tick-borne disease acquired outside of Montana. And you can see kind of varying levels, but a trend upwards as we're kind of thinking about potential, index of suspicion, our concerns as we're evaluating a patient, potentially thinking about their risks. One tool that I can recommend, especially if you want to map out changes looking at different vector-borne illness, there's the CDC ARBANET, and this allows you to go in and look at the various cases, the counties in which they've been reported, the type of disease, the vector in which it's been detected, so whether it was a human, whether it was detected in a bird or another sentinel animal, if it was reported by a veterinary clinic, all of these things. And you can see kind of across the board, it might be a little bit hard in this screenshot, but there's everything from West Nile virus to dengue, chikungunya, Zika, etc., that you can look at and see where in the United States these things are being reported, whether they are believed to be acquired within the state or outside of the state. And so it kind of helps you maybe visualize what the changing patterns in the United States might look like. So what can we do in clinical practice to help reduce infectious disease risks for our patients? First of all, we can recognize the risk factors that might put some at a higher risk versus others. So people who are outdoor workers, who recreate in the outdoors, rural versus urban populations, those who go out and travel to countries that maybe have different patterns of infectious disease. We should be recognizing them and thinking about what patient education and other measures we should be taking to help reduce their risk. Should also think about how people can avoid exposures, educating them around that. Being aware of the changing patterns of infectious disease, so knowing that this is all a dynamic situation, keeping up on the latest in patterns, promoting health professional education and awareness will be important. And also knowing the resources for updates and disease surveillance alerts. So as I mentioned previously, there's CDC, there's Department of Health and Human Services in Montana. There are a number of different things that will help keep up to date as these, various infectious disease cases are being reported. In Montana, one of the best things we can do to avoid tick-borne or mosquito-borne illness is very simple, and that is primary prophylaxis, which is avoiding bites. And all of these things may seem very simple, but I do think it's sometimes worthwhile to review, to think through all of the different options, and just to kind of refresh the different things that you can be educating patients on. So one of the first things that people can do, reducing or avoiding mosquito or tick habitat. So if people are out on property where they maybe potentially have high grass, brush, and they're out walking around mowing, trimming, keeping that brush to a minimum on the property is going to help reduce both mosquito and tick habitat. Also reducing standing water for mosquito breeding, whether that's a creek or overwatering in fields, or even potentially thinking about bird baths or other things that might hold standing water. Those are going to be prime mosquito breeding habitats that people can remove from their environment, and that's going to reduce their risk of mosquito bites. The other thing that people can think about is covering up with clothing, especially in brushy wooded areas and or during peak hours of mosquito feeding. So long pants, sleeves, hats, tall socks, all of those will help protect. And there's also treated clothing or gear with the 0.5% permethrin. This is available in a spray that you can use on clothing. This spray lasts a little bit. It lasts for fewer washes than the clothing that has been pre-treated. Typically, pre-treated clothing will last up to 70 washes, although it is a little bit expensive. There is also a company that will treat any type of clothing with permethrin, and you can ship off your own clothing. They will send it back, treat it, and it's as good as something that you're buying the brand name, brand new, semi-expensive treated clothing with the permethrin. All of this to say that the 0.5% permethrin is a really effective insecticide and works well to repel ticks, mosquitoes, and other biting arthropods. So it's a good thing to think about, discuss with your patients, and to think about the various options that they can use. Repellents, of course, and we'll get into a little bit more detail, making sure that they're choosing an effective repellent and applying at an appropriate frequency. And finally, showering, checking for ticks frequently after outdoor activities. Usually, the length of a tick bite and how long they've been embedded is going to be an important factor in the risk of transmission of disease. And so the earlier you can check for ticks, get them off, the less likely you are to contract some sort of tick-borne illness. As people are trying to navigate options for insect repellents, there are two primary active ingredients out there that are recommended, and those are DEET or picaridin. There are some differences between the two. One of the first things is their duration of efficacy. So DEET, on one hand, has concentration-dependent duration of action, anywhere between 4 hours with the 5% concentration up to 12 hours with 100%. So it's not really that 100% DEET is more effective at keeping bugs away. It's just that it lasts longer. Picaridin, also very effective, but at a 7% concentration, which is commonly available. It's only or just under 4 hours of protection. You can find products out there that are 20% concentration that last a little bit longer. Either way, with both of these, the duration of efficacy or of action here is going to be really dependent on sweating, on the humidity, exposure to water, people rubbing, potentially using towels or otherwise wiping their skin. That's going to decrease the duration that something is effective. So if somebody is in an environment where they're sweating a lot, where there's a lot of evaporation from their skin, exposure to water, it may not matter at all which product they choose, because they're going to have to reapply the product more frequently than every 4 hours in order to keep it on their skin and keep mosquitoes or ticks away. Making sure that people are applying frequently but also applying correctly is going to be important. So heavy application is unnecessary. People don't need to soak themselves. They just need to adequately cover all exposed skin. Don't need to use it under clothing. They shouldn't be using it on broken or irritated skin, and they shouldn't be spraying it, probably goes without saying, directly into their eyes or their mouth. If they're going to try to put it on their face, they should spray it into their hands, wipe it on their face, and really avoid getting it in their eyes, ears, mouth. Washing their hands after application, and then washing off after they return from being outdoors and are indoors again. Both of these products are safe. One of the things to note with DEET is that It can damage clothing or other synthetic items, plastic. It can melt sunglasses. It can do all sorts of things that picaridin will not do. So picaridin also may cause a little bit less skin irritation and isn't something that you're going to have to worry about damage to clothing to synthetics like DEET can cause. Other important notes here. First of all, with DEET, it can affect the efficacy of SPF sunscreen. And so we need to be careful about when and how it's applied. Ideally, you're applying DEET at least an hour after you've applied sunscreen, and really avoiding combo products. Not only are they, maybe more expensive and not, they seem convenient, but a lot of times you're going to have sunscreen and repellent that should be applied with varying frequencies, and those two often don't match up. So really it's better if people can use two separate products, using the repellent and the sunscreen, applying the sunscreen first and the repellent later on. Of course, that's difficult to try to actually enforce in real life, but that's the ideal use. Making sure that people know to check the label, understand what the different active ingredients are, is important, and we'll talk about that on the next slide. Other products that are available out there using various essential oils, things like that, those don't have the same level of evidence of efficacy as these products here. So really, if you're trying to steer somebody in a certain direction, these two active ingredients are going to be the way to go. If somebody really wants to get down in the nitty-gritty and navigate different products available out there, or let's say you're a pharmacist and you're looking to potentially order in some products into your pharmacy and you want to navigate different options, this EPA insect repellent guide is an online tool that will show you you can go through and say, how much time do I want protected? Do I want mosquito, tick protection? Are there certain products I'm interested in? All of that, which active ingredients. And it will give you a list and find different products that match the criteria that you're looking for. So the EPA has this entire comprehensive list of insect repellent data set and gives you very specific information on that. So you can check that out. There's a link here and also in the resources at the last slide of this presentation. The other tool that you can use to help patients navigate is looking at the EPA repellency awareness graphic. So you can educate them to look at that insect repellent, find that awareness graphic, and that awareness graphic is going to show you, does it work on mosquitoes, does it work on ticks, does it work on both, and how long is it going to last? And that can be a nice quick visual cue for people as they're trying to navigate certain products. The other clinical pearls or patient education that you can keep in the back of your mind is making sure that people know how to manage tick bites, or, potentially if you are working in a pharmacy or you're in a clinic or something like this, making sure that this patient education, there are different info sheets out there. This image here on this slide, the CDC patient education info sheet on ticks might be a good idea to have that in your pharmacy or your clinic, so it's readily available for patients to see, to refresh their memories as far as what they should do when they're in tick habitat and when they're potentially exposing themselves to ticks. And one of the things here that's important is managing tick bites, because people can do some damage if they don't do it correctly. So removing, using tweezers, getting the tick as close to the skin surface as possible, not doing any sort of home remedies of Vaseline or matches or anything like that, just tweezers, pulling with a slow, steady, even pressure to try to avoid breaking off any of the mouth parts. And if they do notice that they have broken off some mouth parts and they're visible and left behind, they can use tweezers to remove them, but they shouldn't get in there and do any major surgery to cause any further damage to the skin that might increase the risk of infection. They should just leave it, clean the site, and let it heal. The tick bite area, regardless, should be cleaned thoroughly with rubbing alcohol, soap, and water. And once they've removed that tick, they should not be crushing it between their fingers. They should soak it in alcohol, flush it down the toilet, wrap it in tape, seal it in a bag. They're very sneaky. They like to get out, and they can get out again and bite somebody. So getting rid of them completely, making sure they're sealed, taken care of, is going to be important. Tick testing, this is something that people may ask about. Results of sending in a tick to be tested for disease may or may not be very reliable, and a positive or a negative result may be misleading, so it's not really recommended. Species identification can be helpful, especially if the suspected tick it has been suspected to be attached for a longer period of time. And so in the case of potentially with Lyme disease or things, identifying the species can be helpful. So that would really be the recommendation if a patient's asking if they should save the tick that they've removed from their body. Yes, but not necessarily to send in for disease testing, more so to identify the species. There are more resources and more guidance here if you want to delve in a little bit more deeply into managing tick bites with the CDC guidance for clinicians. And then this slide also contains a link to that patient education info sheet, which has really nice patient-friendly information about avoiding, removing, managing tick bites. Another thing to kind of keep in the back of your mind is knowing or recognizing symptoms of tick-borne illness. So the most common symptoms of tick-related illness are fever and chills, aches and pains, which can include headache, fatigue, muscle pain, and in the case of Lyme disease, sometimes some joint pain and joint swelling, and then rash with some certain types of tick-borne illness. So Lyme disease, southern tick-associated rash illness, Rocky Mountain spotted fever, ehrlichiosis, and tularemia are all associated potentially with different patterns of rashes. And if you get into this slide document here and click on these different links, it will give you specific photos of what these different rashes look like, and some of them are going to be very obvious in the case of potentially like Rocky Mountain spotted fever, Lyme disease. Those kind of have hallmark patterns that help identify, but in some cases it's a little bit more nonspecific, the rash. So CDC guidance for tick bite prophylaxis versus treatment varies. So if you're wondering if somebody who has been bitten by a tick should receive a course of antibiotics for either prophylaxis or treatment, with prophylaxis, a one-time dose of doxycycline within 72 hours of a tick bite can be recommended as long as that area in the tick bite is endemic for Lyme disease. If they think that the tick has been attached over 36 hours, it has been identified as an L. scapularis tick, so the species that carries Lyme disease, and is otherwise, doxycycline is not contraindicated. Doxycycline is not recommended as prophylaxis for other tick-borne disease. Treatment, on the other hand, if you have clinical suspicion at all of tick-borne illness, it's sufficient to begin treatment, and delaying treatment in the case of, waiting for some sort of confirmatory diagnosis can ultimately result in either severe illness or death. So if there's a high enough clinical suspicion of tick-borne illness that signs point that direction, you don't need a positive test in order to start treatment. Doxycycline is one of the most commonly used for Lyme, Rocky Mountain spotted fever, etc. But you should always look at current IDSA guidance for dosing, any other alternatives if first-line agents are contraindicated. Finally, here are just some recommended resources to help you keep up to date, to find toolkits and guidance and patient education information. All of the CDC resources are really great. There's the CDC Yellow Book that's helpful if you're working with somebody, both if they're traveling domestically, but also if they're traveling abroad. EPA Insect Repellent Guide, the National Pesticide Information Center, both of those have really great resources for insect repellents. And then the Montana DPHHS Communicable Disease Surveillance. All of these links here are some really good resources. Check them out if you're interested in learning more.